Dr. Amesh Adalja joins us now. He's a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Doctor, good morning. You're in Pittsburgh. You've been outspoken in your belief that the way the J&J vaccine was paused was a mistake. You say it'll come back, but it'll come back damaged. Can you elaborate on that and talk about what you believe happens next?
So what I think is going to happen is that the Johnson & Johnson vaccine, in the minds of the public, is going to be relegated to a second tier. People think it's going to be a second best vaccine, and they're going to be much more likely to get the Pfizer and Moderna and want to try to steer away from the Johnson & Johnson because they're going to remember the headlines. They're going to remember this was the last in a series of negative headlines about the Johnson & Johnson vaccine, including earlier headlines about people misinterpreting its efficacy, saying it wasn't as good. And I think that's going to be damaging because we have so much vaccine hesitancy in this country, too much really than we can really tolerate with a virus this contagious. Anything that contributes to vaccine hesitancy, and the anti-vaccine movement is already seizing upon what happened with Johnson & Johnson, is going to make it much tougher to vaccinate the population and cross that herd immunity threshold.
You mentioned that 15% drop by that survey in the belief of the safety of that Johnson & Johnson vaccine. Have you seen that firsthand?
The day that this pause happened, I had two of my friends who were scheduled for Johnson & Johnson vaccines call me and ask me what they should do because they had read that and the states hadn't started to pause yet. It was just a federal pause at that point. And I actually told them, go there. Hopefully they're still going to give you that vaccine. But it's clearly something that's in people's minds. It's all over the news. And I think this is something that's going to be very challenging to overcome. We're going to have to be proactive. We're going to have to show the data. We're going to have to be very transparent. And I think talk about the rarity of this side effect and the overall risk-benefit ratio of this vaccine, because this vaccine is something that can really help us with a virus that's killing at a high rate right now, that is spreading still tens of thousands of cases across the United States every day. So all the tools that we have are going to look favorably when you do a risk-benefit analysis, because these are very, very safe vaccines, despite this small number of cases that might be linked to the Johnson & Johnson vaccine.
You're talking about the perception that people may have of it. Tom, in his piece, mentioned that CDC panel that is set to meet. What do you expect them to do?
I suspect the pause is going to be lifted. You might see some restrictions because what we've seen in these 6 or 7 cases that have been linked is that they're largely in the group of women between the ages of 18 and 48. So this is something we could try and carve out and say, in those individuals that seem to be at higher risk for this rare complication, maybe the Pfizer and Moderna vaccine should be preferred. But for everybody else, especially older people who are at high risk for severe COVID-19, the Johnson & Johnson vaccine is a great option. This is what happened with the AstraZeneca vaccine in Europe, and they still got vaccine hesitancy. But I think that's likely the path we're going to go. I think it would have been better to do all of this without the pause and really just blanket the public with information about this, talk to healthcare providers about this rare complication and how to recognize, diagnose, and treat it without this kind of blanket pause, which I think is going to have cascading negative impact.
Dr. Amesh Adalja, with some great insight for us. Thank you, Dr. Adalja.